Welcome back to the Dementia Collective, a podcast where we explore powerful stories and fresh ideas shaping the future of dementia care and caregiving for Albertans, Canadians, and people abroad. If you're new here, I'm Andrew Karesa, a caregiver, researcher, and founder of BlueBell Village. I created this space because I've lived the dementia journey firsthand. I know what it is like to feel lost, overwhelmed, and alone. I also know the strength that comes from connection. In each episode, we dive into the people, tools, and innovations that are helping caregivers find their footing and their voice. Our mission, to make dementia more personal, more connected, and more grounded in Indigenous ways of knowing, because every caregiver deserves to feel seen, heard, and supported. Today, we have the pleasure of speaking with Dr. Rose Joudi. Dr. Joudi is a consultant, researcher, and international speaker recognized for her leadership in advancing inclusive policies and practices in aging. Her expertise lies in ethnocultural diversity, older adult mistreatment, ageism, and the development of culturally responsive systems of care. In 2024, she spearheaded the creation of the Compassionate Approaches to Ethnocultural Older Adult Mistreatment and Abuse in Alberta, a first-of-its-kind program that has since been disseminated nationally, informing practice, training, and policy across Canada. With specialization in psychological first aid, natural supports, and trauma-informed care, Dr. Joudi equips professionals and organizations with practical strategies that align with equity, diversity, and inclusion priorities. Formerly the project manager for the Weigh-In Network at CARIA, she continues to work with government service agencies and community partners to bridge the systematic gaps and promote age-friendly policy innovation, and ensures that diverse older adults are supported with dignity, respect, and cultural responsiveness. Presently, Dr. Joudi is the Senior Advisor, Gender Equity, Diversity, and Inclusion at Help Age Canada. Dr. Joudi is a current board director for the Alberta Association on Gerontology and a past director on the Canadian Network for the Prevention of Elder Abuse and the Alberta Council on Aging. She also volunteered for 4 years as a community advisor on older adult welfare and safety for Alberta's Ministry of Assisted Living and Social Services. So as you can tell, this is going to be really, really impactful. So Tanse, Dr. Joudi, welcome to the Dementia Collective.
Thank you so much, Andy, and I really appreciate that introduction, and it made me think that I probably need to shorten my bio.
It's all good. You do a lot of things, so there's a lot of things to talk about. I'm sure that there's a lot that was probably cut out of that as well. I always like to start this with a bit of an origin story. So can you talk to me about where you grew up and how you came into this space?
Yeah. Anytime that I talk to people about my life journey, I think they're always intrigued about how I ended up being in Canada, because I was actually born in Baghdad, Iraq. And then as a toddler, we left for the UK, where my dad also studied and finished his postgrad. Then we moved back to Iraq during kind of the end of one war and the beginning of another war. And we stayed there for a bit as my grandparents were not doing well, I guess, physically. And my grandmother was actually diagnosed with a dementia as well at that time. And we did leave again and travel to Libya for a bit, where I also grew up. Ended up, of course, spending my university years in New Zealand, and then immigrating to Canada about 18 years ago. And so here I am ever since.
It's interesting because you've clearly lived all over the world. So how has that informed your way of knowing?
I think the whole journey, I guess, of childhood, adolescence, young adulthood, etc. I think they really are important parts of our lifespan, in which they shape who we are and what we're interested in and how we look at the world. And I think what I found at least is that my immigration experience, as well as my parents' immigration experience, really embedded in me that curiosity about how people navigate and function and process systems and policies and information if they don't speak English as a main language. And also if they carry with them, we carry with us our suitcases, of course, but we also carry our values, our traditions, our beliefs, our behaviors even our interest in food, etc. And we still yearn for connection as well with people who are similar to us in the language and the beliefs, whether they're spiritual or religious, etc. And as a culture, my upbringing was a very intergenerational, multi-household kind of upbringing. And so even when we were in Iraq, my grandparents, for example, lived with their adult children. And as my grandmother was diagnosed with a dementia, she lived with us as family members, my uncles and my aunts. And so for me, as I'm living, and as well as my parents who are aging in New Zealand, I'm also thinking about this concept of multi-generational households and living with family and being connected with family, especially as we grow older. And certain values and certain ways of living become very important to us as we age.
You've mentioned that your goal is to help older adults live with dignity, value, and purpose. So what does that actually look like in practice? Can you give us an example of what that would look like?
Yes. When I talk about and when I think of how can we promote living with value and dignity and purpose, what I really hope for is that we actually genuinely and intentionally get to know the person better, who they were in the past, who they are currently, and who they want to be in the future. And with that, what was their life journey, and what does their life journey from here on look like? And so I'm a huge advocate for trying to know who the person is as we're developing an idea about how we can support them better. And I believe that we can't support people better without really knowing their backgrounds, what is important to them, their values, their beliefs, who they want to be included in this conversation. Because again, I believe that people need to be around others who respect them, value them, and support them. And sometimes it's a family member, sometimes it's a community, and sometimes, especially for me, coming from the Middle East, we come from tribes. And so when we know what tribe a person comes from, we can then connect with that community to see whether or not they can also provide support for that person, support that could be important to them that official agencies or organizations can't provide. So when I say to live with value and dignity and purpose, I mean to know the person truly and intentionally and genuinely, and then to think about how we can create a supportive environment that actually meets their needs and respects and honors who they are.
So how would you say that caregiving differs then between the way we do it here in the West versus how it would be done in other parts of the world, say New Zealand versus the Middle East versus other regions? If you mentioned that caregiving is so culturally specific, in what ways does it actually differ, and which ways do you think the system misses it?
What I find, at least, again, from that, me looking back at my cultural upbringing and my values, and then looking at mainstream or Western values and systems, I find that generally they seem to be very individualized. And so when you look at, for example, collectivist cultures or people who thrive together as a group or support each other as a community or a group, that is a core part of their life and their journeys and how they may best be supported. To look at the individual as an individual could be helpful sometimes, but to also understand who else are integral parts of that person's life and journey, and who do they want to be, of course, with their consent and respecting their input, who they want to be part of this journey as well. To create something just for the person without really including and involving family members, loved ones, or individuals who are important parts of this person's lives, I think could do a disservice to supporting the person that we're trying to support. And so for me, I'm always curious about who else is an important individual in this person's life. Do they want the community to be involved? Do they want their loved ones to be involved? And how does that involvement look like? And to always ask and get permission for that sort of involvement. But sometimes when we miss asking that question, it might seem as if they shouldn't be included, or we don't want them to be included, or this is just how we do things in our systems, and we don't include family members, etc. And I think especially when you're looking at collectivist cultures and families who are multi-generational, they are going to be the carers of that person. And so to include them in that conversation could be a very valuable, supportive key figure.
I hear oftentimes that we have to navigate privacy concerns and the idea of, I can't tell everyone in the family what's going on because they have the right to not have to share information if they don't want to. How do we approach that in a Western context here in Canada, knowing that some of these cultures care a lot about disseminating information between the family, working collaboratively together, but that is almost in a stark contrast to the protection of private and confidential data right now? How do you reckon we navigate that?
You know what, you asked that question, I kind of smiled a little bit because it reminded me of when my grandmother was diagnosed with the form of a dementia. And the doctor basically at that point didn't even ask if anybody else shouldn't know. It was almost like an announcement that this is what my grandmother had to her adult children who were in the presence of that clinic. And it wasn't something that anyone took offense to, including my grandmother. And I think because it was a norm in our culture, is that happy news, unhappy news, the good and the bad, they are shared with the family, because the burden, let's say, or the news itself is shared as a family and as a tribe. And as a result, navigating this difficult diagnosis was something that was almost like a family consultation and event. I do understand, however, that in Western systems, of course, there is privacy and confidentiality policies that need to be respected. And so I'm not saying that these things shouldn't be adhered to or followed, because they are important, and they'll get people in trouble if they don't. But what I would like to urge professionals and practitioners is, first of all, of course, to include and address the individual who has been diagnosed in that process, to reaffirm that privacy and confidentiality are very important and to be respected, but also then to ask the individual, who else would you like us to share this information with, or is there anybody else that you'd like to share this information with, and how would you like the information to be shared? How does that look like? And to have the person be at the forefront of making decisions. And it could be, even especially if they don't speak English as a first language, by the way, it could be a family member who's actually attending with them to do the translation and interpretation. And so that person may actually be already in the know as they're doing that interpretation and translation. And so I think in some cases, I'd like us not to be too rigid and strict, especially if we know that and we understand and respect the backgrounds of individuals, but to also, of course, be mindful of the restrictions that need to be considered, but always include and involve the person themselves in the decision making about, how would you like this? What would you like us to share? Do you want to share this information, etc., and get them to be involved as best as they can in that process. But the reality is that sometimes we won't be able to do that, because, like I said, a family member might be the person who's going to be the interpreter and translator. And so to be respectful of the culture of the person and how they want things to be processed and shared, but also to be mindful of systemically how are things expected of us as professionals in a Western system.
It really sounds like this is driven on being proactive rather than reactive. So once we're aware of these things, and then have discussions with our loved one, rather than waiting till we're way too far down the road for them to really have the cognitive capability to make those important decisions, right?
Absolutely. And I think having the person as best as they can at the forefront of that decision making is absolutely important. It's important to value and respect people's personhoods and their agency and their abilities to make decisions. But it's also important to respect their values and the cultural upbringing that they also want to be a part of that transaction between professional and patient or client as well. And like I said, sometimes you'll have the family members accompanying the older adult or the person who's being supported, because that's their support system. That's the person who is there to help them make sense of what is going to be shared with them. And sometimes they will defer decision making to that individual based on who they are. If it's an adult child, and I believe my adult child knows better than I do or can make sense of information better than I can, sometimes the parent will defer decision making to that adult child. And it's not to say that the older adult can't make their own decisions. It's just that sometimes in families, the hierarchy is the person who has the more knowledge or education, or it could be the person who is older who makes those decisions. And so to respect those, the decision-making process in some cultures, I think is also important as well, but to also respect the agency and personhood of the client or the patient that you're working with is also very valuable and important.
From your experience, how does dementia caregiving specifically change between cultures?
Like I guess in a sense, I mean, if thinking back to, for example, my grandmother, when she was diagnosed, she had already been living with my uncles and aunts in my grandfather's house. So after my grandfather passed away, my uncles and aunts and their kids and their spouses, they kind of moved in this big house because, again, this is a shared responsibility. And my grandmother, despite her decline in cognitive capacity, still remained the head of the household. And so she would still make decisions that were very well respected and listened to. And I think for her to continue to be able to cook and to be able to still give advice and open up the albums to share with the grandchildren pictures and stories about people who she remembered still, in part of that long-term memory aspect of her capabilities, and to have her family member be patient and listen to stories that may continue to have been said before. I think all of that added really to quality of life of hers that could be missed if we were to institutionalize, let's say, this individual, including family members and including the person in a journey of life that is as normal as possible, I think is really helpful to not only maintain the current cognitive capacity that they have, but also to maintain a quality of life that really aligns culturally with the individual.
You brought up a really interesting point that I kind of want to ask about. So how do we do this in an institutionalized setting?
That is a question that probably requires a longer conversation, to be honest. And it's not to say, and I honestly believe this, by the way, I think we are trying to do better as a society. I think we're trying to do the best we can with whatever resources we have. But I think I have been amazed by the number of people like yourself and like others in the province who are genuinely passionate and motivated to do better, to support older adults better, especially those who have been diagnosed with a dementia. However, with that being said, I think there are some systems, there are some places that still do things like they did before. This is how we've done things, and this is how we'll continue to do things. Or they tend to cater for a specific group of people of a specific background. And that's not to say that that might not work, but I think to really understand the diversity of our society is to also understand that it is never a one-size-fits-all approach, not in the way that we support people, and not even in the way that we talk about the language that we use, and we talk about various stigmatized topics, including dementia. So how can we do better? Well, it's, again, to really look at the person as a person and not to treat them any differently just because of this experience of theirs. And it's not to minimize a diagnosis, but we all know this: person first, diagnosis second, right? And so to try to really understand, again, who this person is, who they were in the past, and how we can support them to maintain who they want to be throughout their journey, throughout the time that they have, and to genuinely develop approaches and ways to support them that actually matches their cultural, religious or spiritual and personal needs. And when we look at a person, as opposed to putting them all in a melting pot, and to really believe that people, regardless of their diagnosis, can still thrive, I think that's where we'll see change. Where we don't see change is when we have people sitting around in wheelchairs, just in corners or by the walls, and then we treat them as if they're children. We treat them as if they're incapable. We treat them as if that's it, they're a lost cause. That to me is heart-wrenching, to be honest. And I would never would have wanted my own grandmother to have been treated that way.
And I think for me, that's the important part is, would I want my loved one to be treated this way or to be cared for in this way? I mean, that's what created BlueBell, was seeing that experience. Can you talk about the risks for seniors if their caregivers don't necessarily understand their cultural identity and cultural beliefs? What risks are present for them?
I wouldn't necessarily consider them risks as such, but I think there would be things to pay attention to, because if not, then it could cause I guess some disruption in the quality of the relationship, but also some miscommunication. I always am cautious about some of the language and the terms that we use and the language that we use. And I think, again, if you look at the way that we approach dementia, for example, in most cases, we're trying to do better with adjusting the language from deficit-based to strength-based, focusing more on what capabilities the person comes with, as opposed to what they cannot or that cannot do, or what they don't come with. And in the same way, when you're trying to understand the person, if you are a hired, let's say, caregiver, I think it's very important to really understand who the person is that you're looking after, and not to look at them just as in that transactional way, that you're there just to do the job and then to leave. Because I think that would be very detrimental to the relationship that would not be formed at that point, but also on how we treat people and how we feel about the way that we're treating people. I really believe that if the individual chooses a profession, that sometimes it's very important to be passionate about it, to really be invested in it, to really think about why I'm doing what I'm doing, and am I making a difference? And it could be a small difference in the person's life, but what a great difference that would make if you're sitting with them patiently, going through albums, trying to understand who they were, maybe listening to stories that they'll share with you, and how great that relationship and that bond can be, and how stronger it can be as you're spending quality time with that person. And honestly, at the end of the day, Andy, I think, what do people want? As they grow older, they just want to be valued. They want to be respected. They want to be listened to, and to share their stories and share their memories with people who truly care about them. And whether you're paid or not, I think that should be at the forefront of how we interact with individuals. Now, in some families, for example, like our collectivist families, whether they're families where I come from, whether there are First Nations and Indigenous communities of families, you're not paid caregiver, you are a family member. And this is something that I really realized was highlighted in my conversations with communities, is that even the concept of caregiving is a Western concept, because translated to some languages, it's a paid individual who is not a family member. Whereas when I ask adult children or family members what they would be referred to as, they actually just looked at me and said, I'm a family member, I'm a daughter, I'm a son, I'm a cousin, I am an aunt or an uncle. So to slap a Western label, which is caregiving, on what they're doing is almost is a form of disrespect to that relationship they have with the older person.
It's interesting, taking a step back, when you were talking about that this caregiving shouldn't be transactional. You should build this relationship, get to know them. I think fundamentally it's kind of hard especially when you hire someone to come look after your loved one, you hire a home care company, because oftentimes that is a transactional business. They're the people that are coming in and caring are not always the same. Sometimes they leave and go to a different one. Sometimes I need someone else to come in. So you put the company will send the new person in. So it fundamentally is transactional. So it gets complicated to ensure that the person that's always caring for you is the right one, that understands what you need, understands your cultural identity, understands where you were raised. I think it's a complicated manner. Like, how do we do it? I think it's something we need to existentially consider from a collective mindset, not just like I do this, you do this other thing, but like, how do we all together work towards that common goal? I think is a bigger notion.
I 100% agree. And yes, sometimes, saying things is easier than actually doing some of these things, but they're not impossible to do, right? And I really believe that sometimes the onus really is on those organizations or those companies that are hiring individuals. The responsibility is on them to train them adequately enough to be able to be mindful of cultural differences and sensitive issues, and to be the best they can. So I think sometimes what we're not doing is we're not really equipping the people that we are hiring and sending them off to families with the right knowledge, with the right education, with the right training and resources. Because when they feel that they have been provided with the right tools, it makes sense for them to be able to use it the best way they can, right? But if it's just a matter of hiring people and paying them to do something so at least you can gain from them, I think in a way, are you really in the right field then of compassion and empathy work, right? And so I think if I go back and maybe add a few things, I'd say there's ways where we can balance respect and safety, especially in paid caregiving roles. And the important component here is that honoring the cultural values is essential, and training people to honor and respect that is very important. I might come from a background where things are done differently, but it's not about me as that paid caregiver. It's about the individual and their families who are trusting me in looking after and supporting this individual. So organizations or companies should, first of all, understand who the family is, what their backgrounds and what their beliefs and value system looks like. And then to look at the person that they're supporting, who that person is and what their values and beliefs look like. And then to be able to find ways to not necessarily match, but to be able to use that understanding and information to train and provide awareness and knowledge and tools to the caregivers who they're sending off to be the paid person to support that individual. So I think the balance here comes from having open and honest conversations with the person and the family, and acknowledging what are important to them, whether it's cultural values, family values, spiritual values, etc. And then including that in the way that we're supporting this person who's coming from the outside, because usually, and in many cultures, the care of the older person is from the inside, right? And so how can we bridge those differences to make it as smooth and as successful as possible, I think is important.
If we're bringing in those hired caregivers and we're hired people to help complement what we're doing for our loved ones, you've talked about before that mistreatment is a possibility, that there may be things done that we don't necessarily agree with or approve. So what should families look for when they're worried that their loved one, say with dementia or not, might be experiencing these mistreatment, especially if the individual themselves cannot clearly articulate what's going on, they cannot necessarily advocate for themselves? How do we approach that? What do we need to be aware of?
I would always suggest, if the person is saying that something is happening to them, first and foremost, to believe them, right? That's the first thing. That's the start, is to believe the person if they are expressing that things are uncomfortable or challenging, or that they're being mistreated. Then after that, I think it's almost like families do have to, unfortunately, play the role of being investigators. So looking at physical signs and emotional signs. That could include unexplained bruises, sudden withdrawal, fear around certain people, maybe changes in hygiene, changes in nutrition, changes in medication that are prescribed. The emotional signs and cues are just as important as well. You want to pay attention to, is my loved one acting a bit different or a bit off, and not their usual self? Now that sometimes could be as a result of the cognitive changes that could be occurring, but there are things that maybe you want to look for if, let's say, we're ruling out some of the effects of cognitive decline on their emotional well-being. So are they more anxious than they were before? Do they seem to be more distressed? Again, especially around particular people, especially around particular parts of their body, if you're helping them change, etc. Are they usually unusually quiet? Sometimes these signs are subtle. Sometimes they could be other things that aren't necessarily forms of mistreatment. But I think to really do often check-ins, and ones that are unexpected. So rather than say, we're coming to visit my mum at 1 p.m., just say, we're going to come to visit, right? Or maybe not even announce the visit if you're going into a retirement community where those things don't need to be announced. And I think, to ensure that the community, the retirement community or the memory care community the person is residing in, everyone knows that this person has family. What I find really disheartening sometimes is that the isolated, the lonely older adults, the ones who don't get regular visits, who don't get any visits at all, they're the ones that are far more vulnerable to being abused and mistreated and neglected and exploited, because people know that no one checks in on them. And even if they have check-ins, it could be via phone, it could be very brief and quick, right? It could be very sparse. And so having check-ins, I think, is important. Making everyone know that this person belongs to a family and is loved and is cared for is important. And those could be protective factors to prevent them from being mistreated.
I know I had a conversation with an individual. He was an Indigenous individual, and his mom was in a an institution facility. And he was talking about the mistreatment she was experiencing, but it wasn't necessarily from the staff. The staff were kind of sitting back and not actively mitigating it, but all her stuff kept being stolen. And it wasn't being stolen by staff members, but it was being stolen by specific other individuals in the institution. They kind of were sitting back, not dealing with it. And this individual came to me like, what do I do? How do I navigate it? And I mean, that's a very specific circumstance, but it's a complicated one family has to go through too. the mistreatment isn't only from a staff member to the individual, it could also be within the environment that they're in, other individuals in there.
Yeah, and I can see that sometimes happening from people who are living and residing in that community, I guess, or even their family members who come to visit them, who may notice that a person isn't being visited or being checked in on as often, right? And so the reality, the unfortunate reality is that abuse, as you said, can happen from the outside and from the inside, right? And I think if that is occurring and it's not being addressed, that speaks to the level of support, but how things are managed within that community itself. And again, I always err on that side of caution, and I give people benefit of doubt that everyone's trying to do their best. However, in some cases, no, you have to call it what it is. And in some cases, communities aren't run by people who genuinely are passionate about what they're doing. It's a business at the end of the day. You look at people as dollar signs. And that is what makes our community more skeptical of having their family member move into a community or a memory care location. I don't want to call it an institution. I think it just makes it sound horrible. But yes, in some cases, it's a locked ward, really. And people don't want to think about having to reach a point where they're considering a place like that, because you don't really hear usually the good stories, right? Senior living retirement communities did get a bad rep during COVID, and so people became a bit more cautious about considering them as options for their family members. But like I said, I think in the past 5 years or so, we are seeing these communities try and do things differently, because the people who are, sometimes it's really, honestly, Andy, it's about the people who are running the place. It's almost like when you're thinking about schools, it's always the principal and teachers who seem to be the people who, if they're good people, then the hope is that good things happen in that place. If the people who are running these communities and these places where our older adults are residing in are good people with good intention, I think we can see many great things happening. But if they're seeing it as a business, where it's just a transactional relationship, that's when things go downhill. And I would stand my ground and point these things out. And if they don't change things and do things differently, then I would definitely take it to hire people and see what happens there. Sometimes you just have to be the advocate, right, for your family member, especially if they can't advocate for themselves. I think sometimes we have to be their voice.
That's such an important thing, is that if they can't be a voice, we need to be bold to have that comment, have that advocacy for them. What is the complaint process like? So if I'm seeing mistreatment, I will go and maybe bring it up to the staff, someone in administration at the company or facility, whatever it is. What happens if we're not seeing change at that point? Who do we call? Where do we reach out? Is there a process?
There isn't a one size fits all kind of process, because every agency, every organization, every community, they have their own procedure and process. Usually you do start off with making a point that you know that something is a bit off and not right. And whether that is usually, saying to the person who's looking after your older adult that you're not really happy with how things are, who can I talk to? And it usually would be, kind of upper management or upper leadership. Now, it depends on what the situation is sometimes. If it's, let's say, someone is having items missing, then you can bring it up to the caregivers or the individuals who are looking after and supporting your person by saying, we're missing a few items here. Who can I talk to about looking for them, or how can we prevent this from happening? If they're more serious things, like you are concerned about abuse, mistreatment, exploitation, or serious neglect, then I would definitely skip and go upper management immediately. Executive director of the place, maybe the director of health and wellness, who would usually be a nurse, for example, and take it up. I don't mess with these things. Like, if I really feel very strongly that this needs to be addressed, especially if it had been slightly addressed in the past and nothing has changed, or things are getting worse, then I would then initially revert to going up in terms of that leadership. If I feel that leadership isn't addressing the issue, then I would look at who is upper or higher than the executive director. Sometimes it could be the board of directors. Sometimes it could be the president or the CEO of the organization. If it's more serious, again, and I've seen it happen here, I would take it to media. And so there are various ways that we can start to address these things, but I would initially start with the community or the organization itself to see if they maybe were unaware and I'm making them aware and we're addressing that. And if we feel that it hasn't been addressed adequately, or matters are getting worse, or they seem to be not interested in addressing it, then I would take it to the highest level possible. And we see it happening quite a bit. And only then, unfortunately, does change happen, which is unfortunate, right? Because why do we need to drag it out like that in order for you to actually do something that sometimes is really easy and is easy fix? It's just that people, like I said, either they're not into it because of passion and belief, or other issues, right? Or other concerns.
100%. I think it's also a very complicated thing, because as a caregiver, you're probably concerned if I say something wrong or if I offend the organization, then maybe it'll impact the care that they're delivering. I mean, I've heard that from caregivers. I don't want to say anything because I don't want to put a negative stigma on my loved one. So I think it's a tricky position for the caregivers to be in. But the important thing is that they are sometimes the only people advocating for their loved ones, so they need to have the strength to do it even when it's hard.
It is. I think it's one of those things where, yes, it's if I say something, then could that backfire on my older person or my family member? And if I don't say something, what are the consequences of that on my family member? Again, like I said, I really believe that we're trying to do better as a society. And I believe that if you have put your person in a place where you feel that they are respected and supported, and if something happens because of lack of resources, because of lack of enough people to look after, sometimes those things can be addressed, and it can be addressed on levels where there's open conversation and transparency, and it can be dealt with. I think in a rare occasion, do things need to be taken to higher levels? But I think just really having that honest and open conversation. And at the end of the day, Andy, I believe that people need to almost shop around before they even think about putting their family members or taking them to some of these places, as well as potentially, if possible, having that older family member be part of the conversation about where they want to end up living in, because it is a decision that really needs to be made by not just one individual, but of all people involved, including, and most importantly, the older person that is going to be living there. Having them have a say is important, because again, I worked in senior living for a bit, and I found that those individuals who almost were forced by their adult children to move in were the least happiest. They didn't interact socially. They wouldn't want to leave their rooms. They seemed to be very unhappy and sad being there. And the ones who thrived the most were the ones who willingly either made that decision themselves while they were cognitively capable, or there was an interdependent relationship in which it was a reciprocal decision-making process between the older person who was moving in and their family members. They're the ones who actually thrived the most in those environments and communities.
Earlier in our conversation, you talked about the language used, and you're very careful about what language was used. For example, caregiver, we talked about the way it's broken down in other cultures. What words or phrases should we as caregivers, let's use the word again, even though we said not to, but caregivers as in family or hired or medical professionals, what words should we stop using, and what are some alternatives we can use instead?
Yeah. Let me just also make sure that I also tell everyone who's listening to this that the term caregiver or carer isn't kind of the bad word in itself. What I'm hoping for is, however, is when we are addressing family members who come from backgrounds and cultures or upbringings or communities in which looking after their family member is a norm and part of their values and their traditions, I think we should just be a bit mindful. I would say, in Canada, in English, we use the term caregiver or carer, and it's a person who's supporting and looking after the older person. What term do you use in your language, or what term do you use in your culture or your community? And to use the word that that person and their community uses. That is not just you're not just respecting and honoring their backgrounds, but you're really building a trusting relationship, or starting a trusting relationship with them, where it genuinely is not just about you and what you think is best for them. It's about them being part of that conversation and being included, in their voices included. And I think that's honoring and respectful of the individuals and who you're working with. So that's really just what I want to highlight about the whole caregiver component. And I was told off by elders of a community to use that. And so it's one of those things where I'm very mindful of, I'm very sensitive to. With that being said, healthcare systems in general, like, when you go into a hospital, usually the doctor asks you, what is wrong with you, right? You're here. Clearly there's something wrong, right? We're really wanting to shine a light on the language that we're using, and how, again, we've always used this language, and so why change? But I think we're changing. The fabric of our society is changing. This whole deficit language, what is wrong with you, is not a trauma-informed approach, because it's not what's wrong with you, it's what has happened to you. Why are you here? Tell me about your story. It's looking at the person, again, not as what is wrong with them and what they cannot do, but also thinking about and asking them, what can you do? What strengths do you bring? What coping mechanisms and what resilience does this person have? Clearly, because they may have lived through a lot of experiences that has given them tools to manage and navigate. Deficit language, we usually hear, focuses on loss. It's things like saying a person has dementia. You don't have dementia. It's not something you tag along with you because you've signed up for it. People are diagnosed, they live with, but it's the person first and the diagnosis next, right? So we say dementia, living, they have dementia, they have depression. We don't say a person has hypertension or has diabetes. They're living with it, because life continues despite what we have experienced or what we're experiencing. Thinking about people as a burden, saying that they're suffering, for example, saying that we are obligated, right? Like this concept of filial obligation, which is actually where family members are responsible for their older adults. It's not an obligation for some people. It's a role of theirs. It's an honor for me to look after my older adult, just like they looked after me, right? And so I think sometimes it's just really tweaking the language to how we said things before. And what they do is they strip agency, they strip independence, they strip confidence and self-worth, and flipping it to say, what are the words that we can use that really highlight capabilities and strengths and personhood? I'm not an advocate of shying away and naming things as they need to be named. I 100% believe in that. But I also think we have to be very mindful and respectful of the way that we're using language and how that could interfere with the building of trust with this individual or their community. And the same thing goes for caregivers. I've heard caregivers say, I'm just a caregiver, right? But I would say you're a supportive person. You are a caring individual. You are a carer of this individual. because your role is also very vital. So language 100% matters. It shapes how we see people and also how they see themselves.
So when working with immigrant and ethnocultural families, how do you suggest navigating different cultural expectations? So Western culture would assume this is what you're going to do, this is how you're going to do it, but another culture is going to deal with that one. So how would you suggest that hired caregivers address these different cultural expectations?
I think, like I said, really it's just to be very transparent and open, have open conversations with the individual and their family included. Sometimes I would recommend to some staff or team members to really just ask the person and or their family, depending on capabilities, of course. Tell me more about your life. Tell me more about what is important to you and to your family. And is there anything from your culture, from your background, that is important to you that you would like me to be in the know of or knowledgeable about, so I can support you better, right? So really, it's again, I mean, it sounds easy. It's not easy in some way. It can be easy if we want it to be, but it's not impossible to really, again, sit down and have open, honest, respectful conversations, and to not assume that we know everything. And I think that's an issue that we have in our Western society, is that we believe that we can be culturally competent. And I don't believe in that. I don't believe in cultural competency. I believe in cultural compassion and humility, which means that we can never know everything about a culture. I don't know everything about my own culture, let alone somebody else's culture. I can learn it, I can be educated, I can study it, but I'm only going to know this much about it at the end of the day. What cultural compassion and humility actually suggests, however, is that we are open about those flaws of ours, that we're very honest and say, I don't know everything about your culture, but I am wanting to learn. Please teach me. And I know in our First Nations and Indigenous communities, our elders are the sharers of wisdom and knowledge, and that's how we learn. It's by storytelling. And I look at my own culture, my own upbringing back home in Iraq, and again, we listen to our older adult family members. There's a hierarchy where my grandparents are the head of the households, and they share with us stories and knowledge about how we interact and how we behave, and mannerisms and things like that. And it's all about that continuous growth and learning, the fact that we can never know everything, that we're very open and honest about it and humble about it, but we're willing to learn. And so even when I said to you that the term caregiver, I was, lovingly told off that the term caregiver was disrespectful of the role of family members. I said, thank you for telling me this. I really appreciate it. And I will try and do better next time. And I genuinely meant that, which is why now I mention it every now and then. It's a lesson that you never forget.
It's interesting the amount of times on this podcast where someone has said, this word means this thing, we need to be cautious of it. I think probably every other episode, I get a little nugget of wisdom of like, don't say this thing, say this thing. This is how we should use this thing. So I got an ongoing list in my head of what should I be cautious of. And I think that as we kind of unpack these things more and more, we get this Rolodex of things we should be cautious of, things we should say, things we shouldn't say, how things are best rolled out in specific contexts.
And let me just add one thing as well, Andy, to that, is that I don't want us as a society or as communities who are supporting others to be worried too much about putting our foot in our mouth and saying the wrong thing. Again, the example was that I thought that I had the knowledge to be able to navigate a topic. You've got the fancy PhD, you've got the expertise, people say that you know quite a bit. And so not that I went in kind of feeling very capable as such, but I thought that I wasn't going to make an error, and I did. And I think what is very important for us is to really just be kind to ourselves and give ourselves grace too. We will make mistakes. We will say things that are probably not appropriate. But what matters the most to these communities, especially our ethnocultural and our racialized and our First Nations and Indigenous communities, is to own it, to own the fact that we made a mistake, to be humble about learning from it. And I had a person who asked me once, well, I don't speak the language of my clients or patients or the community, so I probably won't be able to support them. And what I said to them is that compassion and empathy transcends any language. And I absolutely believe in that. You don't need to speak the language of the person that you're serving and supporting, because if you come across as genuinely compassionate and genuinely empathetic and really just wanting to help them the best way that you can, there's an aura or a vibe that just kind of is secreted, I guess, from you, and people will pick up on that. They'll pick up on the fact that, yeah, language, we could use sign language, and sometimes I'll use images and pictures and things like that. I'll use a lot of body language, for example, or I'll talk slowly, or I'll have someone who's a translator or an interpreter. Just because I don't speak your language doesn't mean that you won't be able to pick up that I'm here with compassion, empathy, and integrity.
On a previous episode, we had Dr. Sharon Anderson on, and she was talking about this idea of double duty caregivers, where individuals work in this space, in the caregiving space, caring for individuals, whether they're nurses, whether they're health techs, doctors, whatever it is, but then they also take on this caregiving role. As you were talking, I was really thinking about the idea that some non-Western cultures, Middle East, my wife is from Latin America, they have it strongly as well there, where the family cares for their loved one. I was thinking about the concept of double duty caregiving, and that in some of these collectivist cultures where the elders aren't just in an apartment somewhere and you visit them for 3 or 4 hours a day and then you go back to do your health job and you kind of have this circle thing. Instead, where they actually live with you, they're part of you. I think that is a more complicated thing, especially for double duty caregivers, because instead of being able to drive and walk away, now you're having to live it while working. It's a 24/7 thing where you might be thinking about 24/7, but now you're actually immersed in it 24/7 and you can't get away. And I think that might, I wonder, does it cause a larger burnout in these communities where the loved one is living with them as part of this collective community, and the obligation is higher for these double duty caregivers?
I have no doubt that it is quite challenging, especially like you said, if you are looking after a loved one and there are changes that are occurring, whether they're behavioral, emotional, physical. And if you have a family, for example, as well, where you're looking after your own children, partners, etc., and you have your older adult family member that you're looking after. So I have absolutely no doubt that what they're doing is very challenging. But it's a very important role for them too at the same time. Like I said, some families believe that it's not even a question whether or not I'm going to look after them. It's just, it happens. It's an organic expectation. And I believe that many of these families don't even flinch, or they don't even second guess whether or not they can do it. How I would like to approach these conversations sometimes is I have to really make sure that they know that no one can do this alone. Yes, this is your family member. Yes, you know them best. Yes, you would feel far more comfortable sleeping at night knowing that you are the person looking after them. However, you shouldn't be doing this alone. I mean, we always say it takes a village to raise a child, but I think it always takes a village to look after, whether our people, whether they're children or older adults. And if you think back home, for example, again, from where I come from, it is the village, it's the tribe, it's the community that is an essential part of that family. That would, if the adult child has to leave for work, then there's somebody else who's going to be sitting in the home with them. For us, for example, my aunts and uncles and their families lived in this house. And so if my uncles had to go to work, their wives or my aunts were the ones who were looking after my grandmother, for example. And so it's one of those things where I really would like to see more of us as a community. I think now, I was reading an article a while ago that actually said that now more than ever, even people from Western backgrounds have realized the importance of this whole idea, the concept of the village raising or village supporting. And they're also in on that, wanting to build their village. Sometimes families are smaller just because that's how they're made, right? But then your neighbor, your friend, they're also part of your community. They're also part of your natural supports too, right? And so it's a very sensitive conversation to have, but I think it's very important to respect the boundaries that the family members want to create. They if they want to be the main person who cares for the older person, then I think we need to respect that, but to also ensure that they know there are resources and supports put in place to also assist you. You don't really have to do this alone if you need, and it's not a weakness to ask for help. And I think that's what I want to remind some of our community members, that actually asking for help is a sign of strength, because we all know our limits. We know that sometimes we do need a break. But we also, but also being the person who's supporting and looking after our older person could actually be the thing that is adding value to what I'm doing as an adult child, for example, right? And so to respect what the boundaries look like, to respect what the family member is wanting to be the main caregiver, what they want, but also to ensure that they know that if at any point you feel like this is getting a bit too much, or that there are resources that you may need, then please know that this is where you can connect with us, contact us, so that there's actually this resource and support available. A lot of people who are newcomers and immigrants are not privy to or knowledgeable about what is available to them, due to language barriers, due to cultural barriers. And so I think sometimes they fall through the cracks, because it almost seems like back home, we were the ones looking after our older parents. That assumption might be what they carry with them to Canada, not knowing that in Canada, actually, there are some resources and supports available, and they're available to anyone. And it's something that people can access if they need it.
Is there a story or a moment from your career that reminded you the work that you're doing truly is matters and is making a difference?
Well, it might make it sound like I'm blowing my own horn if I do that, but
That's okay.
For me, honestly, and people who know me, who probably be listening to the podcast but know me, they know that I do really believe in a better community and a better world, if we have the genuine intention, if we are truly passionate people about what we're doing. And I had been raised in a family and in a culture where being kind and doing good should come naturally. And again, when I think about people who are moving into retirement communities or memory care or etc., I think about my own parents. Like I have them in my mind. How would I want my own parents to experience this? What would I have wanted for my own parents if they were going through this? And so I think about that when I interact with people, and it shows sometimes in me being approached by community members. And I remember sharing some information around personal directives and wills to a community that majority of them actually did not have a will, and almost all of them did not know what a personal directive or an advance directive is, because it was foreign to them. It's not a norm in their culture. And so I was explaining to them why it's important in Canada to have these important legal documents. And I was approached by a couple of older adults who came up to me, and one of them said this beautiful thing that I still remember: may God grant you more health and knowledge so you can come and share it with us. And that honestly made my whole week. I just kept on thinking about, selfishly, how good I felt hearing that from a person, knowing that I gave them information that was out there already, but I just shared it with them in ways that hopefully was accessible, and it could have made a difference in some people's lives. And for me, I think those things really help me continue do this kind of work when I see that it is benefiting people, for them to thrive, for them to have an equally supportive quality of life like anybody else, regardless of their cultural backgrounds and language barriers, etc. It feels good to do good.
That's, I think, such a simple yet profound thing. Just making the choice to do good and help others is definitely worth it, even sometimes when it's hard. When you think about the future of dementia care specifically in Canada, what is giving you or gives you hope?
Like I said, I think what I'm finding is I'm interacting and meeting people, again, like yourself and like people in the great province, whether it's people from Alzheimer's Calgary or the Dementia Network or even Caregivers Alberta. I'm so grateful to be able to learn from and sit in the presence of people who truly are passionate individuals. And I say that knowing the hard work that they do, and the drive and the motivation, and sometimes how difficult it is sometimes to do what they do. So what gives me hope is that there are more and more people who have a growing awareness and commitment to do the best, to provide as best of resources and supports to others so they can do their best, to be more aware of cultural sensitivity in how they're caring for individuals, and the training that they're providing for their staff members, that there's more awareness of the importance of being person focused, driven, and centered. And more families and more professionals and communities are talking about dementia, about reducing stigma, about demanding, really, and rightfully so, for better resources and supports, for having the courage to speak up and speak for people who can't speak for themselves. So I'm really seeing innovation. I'm seeing passion, whether it's through technology, community-based programs, intergenerational understandings and approaches that are really making the difference. But what I'm most importantly really valuing and seeing is, I hope to see that there's more resilience of families and more resilience of caregivers and carers who, despite the challenges, they do show extraordinary love and dedication every day. That gives me hope, Andy.
If you had to give one parting message, you can say whatever you want to the people listening, what would you say?
I would say human compassion and empathy is something that will continue to drive us to be better people, whether it's in the future of dementia care, or mental illness, or mistreatment of older people, and any other topic that is very sensitive to talk about, but very important to talk about. And so that would be kind of my parting little tidbit, is that I really believe in human compassion and empathy. And if you have it, that could make us truly the best community and the best people in the province.
I would argue more than just the province. I would argue that.
Let's do it Canada-wide as well. Let's start with the province first.
Gotta start small, right? Well, thank you for joining us on this episode of the Dementia Collective. It's been a pleasure to have you, Dr. Rose Joudi, come and talk to us. People like yourself are truly changing the way that we understand caring and loving for our elders. If something in today's podcast stuck with you, please make sure to follow the Dementia Collective on your favorite podcasting app or service, and make sure to share it with someone who you think might need to hear it. Today's conversation about ethnocultural caring, very, very important, especially in Canada. If you're walking the dementia journey yourself, We see you. You're not alone. Whether you're just sitting out and figuring out what you need to do next, or you're deep in the day-to-day grind, we're here to help. Visit us at BlueBell to learn more or reach out to us directly. Until next time, remember, you are seen, you are strong, and you're doing something that matters more than you know.